Hi, it's the Nursing Professor here. Welcome to Fundamentals on Friday, and today we have a very important topic to talk about, and it's medication administration. I always remember this motto is to assess before you administer. Do that, you will avoid a lot of unnecessary medication errors. All right, so let's jump into it. So we have lots of resources to help us as we're administering medications. We have the physician drug reference book, or actually it's online now. We have the nurse's drug book, again, online tool. When we're actually administering the medications and we're in the medication administration record, you can click on the drug and it's going to give you helpful hints about administering that medication. And then we have good old Google Smoogle that you can use if you're unable to find a medicine. The point of me giving you these references is that you must know what medication that you're given. Do not give something that you don't understand or you don't know what it is. And pharmacy is also a very good resource for you. So legally, we're the last touch. All right. So if a medication was placed in the incorrect drawer, all right, it's us that is going to administer that wrong medication. And the way we avoid that is always following the 6 rights of medication administration, because you just can't take just because that drug is in an assigned drawer that it is 100% accurate. And if anybody's going to get in trouble, it's not going to be the pharmacist. It's not going to be the provider who order it. If a person has a terrible reaction from that, it's going to be the nurse who actually administer it. So just remember that. All right. We have different systems of medication administration. We have that bulk system or stock supply where you have medication like you have at home. You'll have like a bottle of acetaminophen or a bottle of ibuprofen. If somebody needs 2 of them, you just, put out 2 and the person gets it from there. Don't see that much in acute care. You see it frequently in long-term care. Then we have unit dose, which is where the pills are put into individualized packets for your patients. And they do tend to help us be more accurate in our administration of it. So just because the pills are in the packet, you need to double check that you're given the right pill, because sometimes, doesn't happen often, but the wrong pill could be in the packet that is labeled something. So this is where it comes into play, that makes sure that you have some idea as to what's going on. We have auto dispensers like our Pyxis, our Cows, our Wows that we carry around, and you put in your information, patient's information, and the drawer will pop out and it will have those unit doses in there. But we still got to check. All right. And then sometimes in some hospitals, they'll have the self-administering boxes for patients to give their own medicines to themselves. All right, 2 key concepts we need to know. One is pharmacokinetics, the other is pharmacodynamics. Pharmacokinetics is when we're looking at what happens as this drug is ingested in our bodies. All right, what's going on there? And there's 4 points that I always try to remember, and it's ADME, A-D-M-E. A stands for absorption. How is this drug absorbed in the body? D is for distribution. How is it distributed in the body? M stands for metabolism, and an E for excretion. These things become essential for us to know, because if we have a patient that has some compromise, so say, for example, their liver isn't working properly, then we want to be a little more cautious about giving them drugs that are metabolized in the liver, for example, acetaminophen. All right. And so those are necessary for us to ensure that we're doing the right things for our patients. There are other things to consider as well, is that, the age of a person's BMI, if the person's pregnant or not, the gender, all of those can possibly impact or be impacted by the administration of medication. And so you should know the difference of that, half-lives, troughs, peaks. concentration of medications. All of those things are important for us, and they fall underneath the category of pharmacokinetics. Pharmacokinetics. All right, then we have pharmacodynamics, which is the drug does what it says it's going to do. So if I have allergies and I take a Claritin, then that drug should do what I think it's going to do, which is going to help me with my allergy symptoms. If I have a headache, I take Tylenol, then that drug should do what I expect for it to do, help me with my headache. So pharmacodynamics is looking at the drug does what it says that it will do. So it's those predicted responses, it is intended, it's the desired response that you're going to get from the drug and why it was actually prescribed. All right, so we often have drug interactions that we need to be aware of and try to pick up on them as, early as possible. Okay, and so those interactions can be antagonistic, where you can have opposing drugs, which will drugs that counteract one reaction from the other drug, which is not necessarily a great thing, except in the case if, you have a person with an allergic response, say, and then they take diphenhydramine, then that could be good because it's going to help with that person's allergic response. We have drugs that are synergistic, which help one drug do better, perform better. And so we should know about those drugs that are incompatible, because we should never give drugs that are incompatible. And of course, if somebody has an allergic response, as I described above with the antagonistic effect, and we want to know how we could take care of that. All right. Frequently, you might see it with first time with antibiotics or something like that. Drug abuse or misuse, unintended, illegal use of drugs, where drugs are used in a manner in which they were not prescribed. Frequently, people can build up tolerance to a drug and they might take more. Misuse, of course, would be that they're taking it for the wrong reason. Abuse, again, they're taking it for the wrong reason. They're taking it because they want to feel the effects of the drug as opposed to taking the drug as timed. All right, and frequently this could lead to illicit drugs, which are drugs that are sold on the street. They're basically illegal drugs. So the 6 rights of medication administration that I referred to earlier are you're first going to make sure you have 2 identifiers of your patient before you give it to them. You're going to have the right patient. You're going to have the right drug, the right reason for this person receiving the drug, the right time, the right route, and the right documentation. Now, again, I know in some schools there are 10, and that's fine. You can follow that. But those are the 6 basic ones. All right, and so drug errors, they exist, but we should try to minimize that from ever happening. Usually they exist because of lack of knowledge. So again, use those resources I talked about at the beginning. You will not go wrong with administering the wrong drug. Faulty communication is pretty much corrected now, but maybe you don't understand a provider's order. Call them or send them a message that you need clarification of it. Equipment errors, this frequently happens as well. If there's downtime, computers go down and everybody's like all crazy, like what do I do? What do I do? Because people aren't used to dealing with just paper. All right, and calculations. This is why you get those dreaded drug calculations every semester, because sometimes, especially with high-risk drugs, then the incorrect calculation could have happened in pharmacy, and it's on you because you're the one that's administering that medication. All right, so safety, we're going to avoid those medication errors by no interruptions. Don't be talking to your friend while you're giving medicines. Don't try to pull 2 meds for bed A and bed B. If you still have a hospital that has semi-private room, try not to do that. If you have a question, seek clarification from the provider, not from your friend. All right. 2 nurses are needed for high-risk drugs, things like heparin, insulin. Should have 2 nurses that countersign for that. And sharps, get rid of them as soon as possible. Make sure you know where the sharps containers are and dispose of that needle, because medication, it's not a medication error, but needle sticks still happen to nurses at a rate that it no longer should. Now, one other thing that you need to know is that we have a division called parental medications. Parental medications are those that are either IV or an injection, IV, sub-Q, IM, or intradermal. And you should know the differences in that administration and which one works the fastest, all right? Non-parental medications are going to be the other medications that are outside of that, like PO meds, you take by mouth, intranasally, through your eyes, going inner to outer cannula, your ears, otic medications, skin, transdermal medications. All of those meds you need to know, inhalers as well. All right, so you need to know how to administer those. I will send you back to your videos that show you how you should safely administer those medications. Now, last but not least, and this most important topic, is this book that I came across. And this is written by a nurse. Company is called rnessentials.org, and it's a pharmacology resource guide. This book is, I think, the best book that I've ever seen on the market. I even use it as I teach pharmacology. But the size is great. You can put it in your pocket as you're doing your clinicals. It has everything that you need to know, like where you give injections, the diameter of the needle that you should use, the angle of the needle that you should use, all the things that you should be aware of, as well as it groups together medications like this section here on cardiac diuretics. So it's going to give all of those, because frequently we try to learn all these drugs. And the fact of it is that if you learn drugs by categories, then you'll be much more successful, because mostly they all will work similar. If they are a diuretic, then we know that they are useful in getting rid of additional fluid in our bodies. So I hope this video helps, especially as you prepare for your midterms. Again, this book is called Pharmacology by RN Essentials. Here's a code here. Hopefully you can also use that. And written and designed by a nurse. So this will be very helpful. As I said, this is one of the best that I've seen on the market. So I will see you next video. Like and share. Bye for now.